Okay, so continuing with joints, and we were talking about different types of movements at synovial joints. And so this is a particular class of joint based on mobility. And if you remember, synovial joints are highly mobile. And so we can look at different types of movements at synovial joints. And so when we look at this, we can see kind of in general, um, we have different types of movements that happen here. So um, basically, if something has an axis, so like uniaxial is going to mean one axis. And so that's going to be an axis of rotation. So that's going to be kind of the main point or the area that that movement is going to occur around. So if something is non-axial, it means that it doesn't rotate and it's going to be more of a gliding type motion. So basically where you have like one like flat bone kind of like gliding, across another one. And that's going to be more of a gliding movement. And it doesn't really have an axis of rotation, and so that's why we call it non-axial. These other movements do have an axis of rotation, and these are going to be movements that happen in planes. And so if you remember, way back in the beginning, we had the three cardinal planes, and that's kind of what we're showing here. These are going to be the three cardinal planes, okay? And so this is going to be your transverse plane. That's going to divide the body into a top and a bottom. This is going to be frontal plane that divides the body into an anterior and posterior, and then this is indicating sagittal plane that divides the body into a left and a right. So we're going to have movements in these planes. Transverse movements tend to be rotation, okay, like turning your head, like saying no. Frontal plane movements are going to be more abduction and adduction movements, and we'll get to those in a minute. And then sagittal plane movements are going to be more flexion and extension type movements. Okay, and so that's generally what we see. But what we have are movements that happen parallel to the plane. So for uniaxial movement, we're going to have movement that occurs in one plane of motion. So it's going to be either transverse plane or frontal plane or sagittal plane movement. That movement is going to be parallel to the plane that it's occurring in. Okay, if it's biaxial movement, bi means two, right? So there we have movement in two planes, and then multi-axial movements are going to be movements that occur in multiple planes. So think about like your shoulder joint being very, very mobile, and it can move in all these different planes of motion. Okay, and so this is telling us too the different types of movements that we have. We talked about gliding, so we talked about flat bones kind of sliding over each other. Angular movements are movements that change the angle between two bones. So if you kind of think about your elbow, like maybe here's your arm, here's your elbow joint, and then here's your forearm. If you do like a bicep curl, you're decreasing the angle between those two bones. And if you're letting the weight back down again, and you're going the other direction, you're increasing the angle between those two bones. So that's more of an angular movement. And then a rotation is going to be turning the bone around its long axis or even an axis of rotation. So that's going to be more like saying like no with your head. And every time you see a movement, think about what plane that movement is occurring in. So I've got some images of movements here. These are movements that that you should be familiar with, and these are taken from your textbook. Okay, now we can go through specific types of synovial joints. So synovial joints was kind of a general classification, and we can divide that general classification up to 6 different specific types of synovial joints. So the first one are going to be planar joints or plane joints, and these are basically going to be joints formed by flat bones that kind of glide across each other. This creates non-axial movement because we have gliding with those flat surfaces. So you see this with like the intertarsal joints of the ankle, because those tarsal bones kind of have these flat, edges that make up the joints, and then they glide past each other. Okay, hinge joints, that's the second type. Hinge joint, so a good example of a hinge joint is going to be the elbow. And what we see here is uniaxial movement, so movement that occurs in one plane, one axis of rotation, so flexion extension, and this is going to be a sagittal plane movement. Okay, pivot joint. So this is, for example, the joint formed also, people tend to call it their elbow. It's not technically your elbow, but it's the joint formed at the proximal radius and ulnar articulation here, where you have that round radial head that kind of spins and creates a pivot. And so this gives us uniaxial movement, so axis, one axis of rotation, which is along the long axis of your radius, and it basically creates a rotation here. So this gives us the movement of supination, pronation of the forearm, and because this is rotation, this is going to be a transverse plane motion. Okay, and I think I have, I've got another example of a pivot joint. This is the joint that's formed between the atlas, or C1, and the axis, C2. So these are your first two cervical vertebrae. And they basically do the same thing. We've got, here's the long axis, or the axis of rotation here, and we've basically got a pivoting that happens around that axis. And so this is what happens when you turn your head no. But same thing, this is going to be a transverse plane motion as well. Condylar joints are also called ellipsoidal joints, so they basically mean the same thing. This is the joint formed by the radiocarpal joint. So the distal end of the radius articulating with the proximal row of the carpal bones. And we've got kind of a concave joint surface in one area and a convex joint surface on the other. This allows biaxial movement, so movement in two directions. So we're going to have wrist flexion extension, which is going to be sagittal plane movement. And then we've got wrist abduction and adduction, which is going to be frontal plane movement. Okay, this is another example of a condylar joint. This is the joint formed at your knuckles. So here's your metacarpal. So this is your metacarpal bone here, and then this is your proximal phalange here. So this would be your MCP joint, your metacarpophalangeal joint here. And it also forms a condylar joint. That is biaxial. Saddle joint. So saddle joints are kind of unusual. There's only one saddle joint in the body, and that's at the first carpo-metacarpal joint at the thumb. So this is basically the base of the thumb where it meets up with the carpal bones. And it is a biaxial joint. It's going to have flexion extension and thumb abduction and adduction. Ball and socket joint. So ball and socket joint, we basically got the ball part that's fitting into the socket of the joint. So this is going to be shoulder and hip. So these are your examples of ball and socket joints. These guys are multi-axial, so that means that they move in all planes of motion. all planes, or we would even say like multi, I just kind of messed that up. But anyway, multi-planar motion. So all different planes. And this is showing you hip. Okay, so same type of thing. You've got the ball end of one bone and then the socket part of the other that's gonna form that joint. And then I just included some interesting things. So this is what it looks like when you do a knee replacement. We can't talk about joints without talking about some of this. Where you've got wear of those articular surfaces, and they go in and they're going to replace the end of the femur and then the end of the tibia with these nice smooth metal surfaces to allow for nice smooth gliding of those joints. Hip replacements are also really common, and in fact do even better than a knee replacement does. With this, what they do is they basically cut off the end of the femur, and then they have this kind of femoral prosthesis here. This long part here is going to go down into the medullary cavity of the femur, and then this right here, this kind of proximal head part, they're going to pop it into this kind of plastic socket that they put into the coxal bone to kind of line that. So they kind of pop that in, and now you've got a nice ball and socket joint there. So hip replacements do so well. We actually tend to not even see them in therapy as much unless they're having problems, but they tend to do really, really well. I do have some specific examples, a couple things. We've seen a few examples of dislocated shoulders throughout this. Another common dislocation is a dislocation of the radial head. And we call this, so here we have kind of where the radial head pops away from that annular ligament that normally wraps around the head of it, and we call this the nursemaid's elbow. And you see this with little kids, like if you pull on their arms, like if you're swinging them around, or you pull them up by the arms out of a pool or something like that. You see, little kids, we're like 2-year-olds, 3-year-olds maybe. This is a pretty common dislocation, and fortunately it reduces really nicely, and the kids just go on their way. So here's a couple other examples. This is a posterior ulnar dislocation here. So you can see this is the end of the ulna, where it should be articulating here with the end of the humerus, but it's actually posterior to the humerus, so that's not great. And then here's a lateral dislocation. This is pretty involved here. Elbows tend to be kind of tough, and they are very painful when you have dislocations like this to your elbows. Here's a hip dislocation. So here's the head of the femur. This is the acetabulum, where it should be. This took quite a bit of force. It is not easy to dislocate your hip. So probably a car accident or even maybe a motorcycle accident type of thing. But this takes a lot of force to get that hip to dislocate. And then now here also is a hip dislocation. Look at the head of the femur. This is the acetabulum here where it's supposed to be. And then in this case, this is a hip replacement, and it's actually dislocated. So it's out of place. They need to go back in and pop that into the acetabulum. But after patients have hip replacements, we have what we call hip precautions. So there's certain movements that those patients shouldn't do for the first few months after surgery, and it's important to go by those, because if you don't, this type of thing can happen. They have to go back in and have surgery again to fix that. And then I've got a couple examples. These are some patellar dislocations. So let's look at this guy. Here's kneecap, way over here where really it should be a little more here. And then here is a kneecap way over here. That should really be a little more here, but this is what happens when that patella kind of doesn't stay within that nice groove where it's supposed to be, and it's basically so far out that it just isn't going to pop back in by itself. These are super painful, and so you have to go back in and just kind of move them back into place. But typically not a great time. People are usually in a fair amount of pain when they have this done.